who's can be serving as panelists today and facilitators and scribes for some of the work that we're going to do together as a group. I want to welcome everybody. I'm Jill Jolliker. I'm the Assistant County Administrator for Douglas County. I'm fortunate to be able to be leading the work of facilitating the strategic plan on behalf of the county. And I'm joined with a lot of other folks that you're going to hear from today that are going to help facilitate conversations. And so I hope what you leave today with is a sense of that this is a real collaborative effort with a lot of different leaders, but we hope we can get additional folks to be leading at all levels of the community. And this is just the first of many conversations we hope to have. So we have an hour and a half set aside for this conversation today. I mentioned this a couple minutes ago, but we do intend to shift into breakout groups here in the next 10-15 minutes. There's a small chance that we may have to set up a fresh, I may have to send folks to a fresh Zoom with the breakout functionality working. And I'm going to work on that while my colleague that I'm going to transition to, Leah Roslin with the City of Lawrence, I'm going to let her introduce herself and let her facilitate the next section of our agenda, which is our community agreements. Leah, go ahead.
Thank you, Jill. This is Leah. I'm the Affordable Housing Administrator with the City of Lawrence and have co-facilitated as a convener of the Affordable Housing Work Group and part of this work. And I'm really appreciative of all of you being here today. So this is awkward for me because I can't see the attendees. So instead of doing a community agreement based on what you all normally, I would do community agreements where those would be generated by the folks that are present. This Zoom webinar format is a little bit challenging. So instead I am going to present some community agreements. And
if we want to like, so everybody like give us all some grace. It's our first time doing this. We should know how to do this because we do city and county commission meetings. We can shift real quickly to a meeting. I can put it in. If I can set one up, I'll stick it in the chat, and then I'm going to ask my friends with city and county communications to maybe update our websites real quick. I know this is really crappy to do, but should we just do that so that it's a little more seamless? Would that make you feel more comfortable, Leah, in doing the community agreements?
Jill, this is Carrie Britt. So we have 54 people on this meeting, right? 55 participants. I think we should stick with the current format because that's a lot of people that are listening in and joining our conversation.
Okay. My breakout groups that I set up yesterday are not showing up right now. So that's what I'm struggling with. But yeah.
We'll get through the community agreements. I'll just present them and appreciate everybody's grace and would suggest that if you have anything to add for the breakout room, that's where they'll be the most relevant, is when we'll be actually engaging in conversation. So if you have anything to add, or if there's anything that you're in disagreement with, perhaps the facilitators of those breakout sessions could just start with looking at the community agreements again. And really quickly, I will just share my screen. So really the intent of community agreements is just a shared understanding of how we will be in community and have this conversation here together to have a really productive and generative conversation. And really the most important thing is that we want to hear from you all. Really, this is a great opportunity to get your feedback and your perspectives to make this draft plan even stronger as we move into the final version. So number one, speak up, listen up. We do want to hear your voice and perspective, and we want to hear from as many folks as possible. So be aware of how much you're speaking, allow space for others, but please do speak up and provide your opinions and feedback. Please speak from a place of respect for all people. If possible, leave your camera on in the spirit of being present here in this space, particularly in the breakout rooms, the purpose really is to have a conversation. And it's always helpful when we can see your face, if you're comfortable with that. Please give the benefit of the doubt and assume good intentions. We're all here because we care about our community and want to reach functional zero of homelessness and want everybody to be housed. And so just coming from that shared space of respect and grace, assuming good intentions. This is perhaps more for the facilitators, but avoid jargon and acronyms as much as possible, so we're all on the same understanding. Please use the raise hands feature to speak when we're in the breakout rooms. Speak from your own experience and allow everybody to have their own experience, even as they may differ from yours. And then again, just want to reiterate, please provide your honest feedback. We really want to hear from you. And so I'm going to stop sharing screen and leave it at that. But again, if there's anything to add in the breakout rooms, we would love to hear. We would love to hear from you. I'm going to turn it back over to Jill.
Yeah, and I would also, if folks have questions about the community agreements or have some suggestions for additions, you can attendees can use the raise your hand function, and use the raise your hand function, and we're happy to call on you, and we have time for a conversation if folks have questions about any of that. Okay. Seeing none, the next section of this agenda is my part, and I'm going to provide some background on the process and how we got to this point. I'm going to share my screen as well. Thumbs up if you can see the slideshow. Yeah, cool. All right. So let's see. Clicking through. Okay. So first thing is just some background on the partners that have been involved in this work. There's the list of all the partners here. I'm not going to read all of them, but this group of stakeholders, housing and homeless stakeholders, not a fancy name, but it's the name that we've utilized to keep representatives from each of these organizations meeting on a regular basis since I want to say April of 2021. Stakeholder representatives from each of these organizations have met on a monthly basis, sometimes more, to develop some shared agreements and community and some understandings and commitments around how to address issues of housing instability and homelessness in Douglas County. It started with a convening that the Kansas Department of Aging and Disability Services coordinated on our behalf, bringing in subject matter experts like Sam Sembris, who really is a leader in the work of Housing First and developed a program, one of the most identified programs on Housing First, called Pathways to Housing. And he met with our group in April and helped and gave us some ideas and some energy that translated into the stakeholders meeting on a monthly basis, and eventually leading into identifying the need for a needs assessment, to a couple of needs assessments that needed to be performed to get some information. So we knew what information was needed to develop a well-informed plan. So those two needs assessments that were identified one was performed by the Corporation for Supportive Housing, CSH for short. That was completed in May of 2022. The second one was through the University of Kansas Center for Public Partnerships and Research. That was completed in June of 2022. Part of that work was that part of those two needs assessments was, to identify where we know we have gaps, where we know we have opportunities, where things are positive, but also just getting some data and some information around the gaps to inform our strategies. And so the stakeholder group met constantly with the teams that were performing those needs assessments. And that allowed us when we were ready to review the findings of those needs assessments to be able to identify focus areas that you're going to hear more about in this presentation. So when the work groups began to organize, we organized and began drafting a plan, the draft strategic plan that you're going to hear more about today. And we used a format, a template that our friends at the health department have utilized for the community health plan process. If you're familiar with that, and I know a lot of folks may not be, but it utilizes what's called a Smart Plus C format, and that calls for things for us strategies to be specific, measurable, achievable, relevant, timed, and challenging. That format and the template is not as intuitive as folks may want it to be, but once you get acclimated to it, it really has proven to be a successful template and a framework to measure and have impact. And then we also have a steering committee that includes representatives that are leading the 5 work groups that you're going to hear from that meet on a routine basis to make sure that we're making progress and being good stewards of this plan, not only now, but into the future, and being good stewards of the feedback that we get in sessions like this. So I'm going to provide some just high-level overview of the overall plan, which has an before we dive into the specific focus areas in breakout groups. And the goal of the overall plan is to just come up with a plan. We need a strategic planning framework that addresses homelessness and the needs of affordable housing solutions throughout Douglas County. For a long time, a lot of folks have said, what's our plan? What is our plan? How are we going to make progress? Well, now we're just going to, it's really easy. We're just going to commit to making a plan and proceed with that plan and be accountable to that plan. The overall objective is that by 2028, we will create a system that achieves functional zero through policy, system, and environmental changes, resulting in all Douglas County residents having access to the fundamental human right of safe, accessible, attainable, and affordable housing, in which homelessness is a rare and brief occurrence. To reduce disparities and optimize equity, we identified these low-income populations that will be the focus of our efforts. Due to the presence of known disparities that we know exist, and we saw those were evidenced and documented in the needs assessments that were performed for us, but also there are other leading documents that have been performed on a routine basis, the point in time count, our housing inventory count, and a whole lot of others. So I'm not going to read all of these, but these, particularly that first one, individuals experiencing chronic homelessness, there has been a very long-standing commitment on the part of the county and the city to really lead with solutions for our chronically homeless population. And we know that a lot of the populations of folks that are listed below, there's a lot of overlap within those as well. But we feel like this is a very comprehensive and reflective list. That being said, this conversation today is about getting feedback on what we missed. So to reduce disparities and optimize equity, we've identified some strategies and approaches that will be used to engage these populations in influencing or shaping the plan. So we're going to utilize a trauma-informed holistic approach throughout the development of the policies and the procedures. Comprehensively review the various land development codes and county regulations that create barriers in the development of programs and services, and then engage and empower individuals with lived experience in all aspects of planning and programs. Further, our priority focus areas and a focus on with a focus on personal or environmental factors that known to contribute to the issues. We've got these we have 5 focus areas that we've identified. And the visual that's here, this was what really, this visual resonated for me in terms of how we have stacked these 5 focus areas. So we lead with equity and inclusion. And if you think about equity and inclusion sitting kind of at the top of the visual here, that's feeding into the larger stream. That is, we see equity and inclusion truly informing the work that we do and the impact that we can have on the focus areas that follow. So we know because equity inclusion, the things that we have outlined in that plan, we believe are going to positively impact and influence affordable housing, supportive housing, our systems, and our emergency shelter resources in this community. I like this slide because we just talked, this is, you know, it was a slide that talked about how, you know, the upstream conditions of climate change, as an example, are not usually addressed at this in the same conversation as downstream conditions. So when we think about, you know, we've got to use a systems perspective to have downstream effect on folks that are experiencing homelessness today. We've got to think upstream, and that's the perspective that we try to take with this plan. So our first focus area is equity and inclusion. Very quickly, I'm not going to read all the things that are on this slide, but these are some takeaways from the needs assessments that were performed for the county. So, you know, we know that there's racial disparities that in folks that are experiencing homelessness that require further attention. We know there's gender disparities. And we know that we need to explore opportunities to engage individuals with lived experience of homelessness and engage them in the decision-making and seeking their input. Focus area number 2, affordable housing. We know more affordable housing options are needed. And there's a deficit of population-specific housing options. And there's poor perception of voucher holders. Again, these are findings from the Douglas County Homelessness Needs Assessment that was performed by University of Kansas. Focus area number 3, permanent supportive housing option is for supportive housing. Findings was permanent supportive housing options are needed. Real simple. In Douglas County, there is an estimated need of 381 total units of supportive housing that's needed. Of those 381 supportive housing units, 356 are required to meet the needs of individuals of households with adults only, and 25 are needed to meet the needs of families. And then focus area number 4, systems. A complete picture of the population experiencing homelessness is needed. When you get into data, really important data systems like the Homeless Management Information System, also known as HMIS, it can get real jargony and technical very quickly. That being said, this system and other systems are important to make sure that we're best serving folks that are experiencing homelessness and trying to connect them to housing as soon as possible. So we know that that's important and we can do better. That there's a continued and increased collaboration that's needed across providers. Again, a lot of technical work, but also a lot of adaptive change work and organizational commitments that need to be made to contribute to these data systems. And then our final focus area is emergency sheltering. County and city funded efforts to include continued funding of needed emergency shelter resources. Lawrence Community Shelter is perhaps one of the longest standing commitments that the county and the city have made together, but we know that there's a lot of community efforts that have regarding emergency sheltering that have been longstanding, but we need more. And we need to have a more cohesive strategy to support that work. When housing costs are more affordable and housing opportunities are more readily available, there's a likelihood that there's a lower likelihood of households becoming homeless, and households who do become homeless can exit homelessness more quickly and with greater likelihood of sustaining that housing long term. And that's from the federal strategic plan to prevent and end homelessness. And I kind of wanted to end it there because emergency sheltering, while is a huge need and has been a large focus of this community historically, does sit at it's number 5 on our focus areas because we want to make sure that we're holding ourselves accountable to that upstream work, that we're investing in the equitable opportunities and diversity, inclusion, and equity in all of our systems, and then really looking at the affordability and availability of housing, accessibility of housing opportunities, investing in all that infrastructure that sits on top first and foremost. I'm gonna stop sharing my screen. I'll come to that later. And I apologize. I have not monitored the chat. Okay, so I see that we're gonna shift to 5-minute presentations for focus area and then pause for questions, and then we'll go from there. So with that, I think the first, I'm gonna go to my screen. Who's our first facilitator? I apologize. I have too many screens in front of
That's
me.
me, Jill.
Oh, great. All right, go for it, Lacey. Thank you.
Can I share my screen?
You should be able to, yeah.
Okay. So real quick, I'm going to go ahead. I'm going to share a summary of the equity work group section, and I'm going to
Will you
drop a
introduce
link.
yourself? Will you introduce yourself first too?
Okay, let me get myself centered. Hi, everyone. My name is Lacey Rowe, and I'm the Director of Community Engagement for the Lawrence Community Shelter. I'm also one of the co-leads for the equity work group in this strategic plan. Now, I'm going to go over a summary of our section of the strategic plan. And while I do that, I'm also going to share a link so that everyone can also follow along and have the document with the summary as well. So everybody should be able to see that. And I'm going to go ahead and share my screen and get started. All right, can everybody see? All right, so I'm just going to go through the objectives. I have these organized by year. So by 2024, our goal in the strategic plan, our first equity goal is to have a clear set of equity goals. So what we mean by this is that we want to make sure that everybody is working with the same understanding, with the same shared vision between government, between all involved agencies, making sure that we have consistency in our communication and what we mean with different definitions that we use and how we approach achieving equity and serving this population. And then our second goal is by 2024, prioritize equity and community education resources. So what we mean by this is making sure that the resources that we have available to the broad community are equitable and accessible to everybody, making sure that we have multiple translations of community resources and making sure that these are well distributed so that they're getting to the people that need these resources the most. And then in addition, with community education resources, this also means making sure that service providers are all communicating well and that we all have this, again, this shared understanding of what equity means and how we achieve this and how we're each working collaboratively to achieve equity and have the same understanding and same training and shared perspectives. Also by 2024, we do intend to have ongoing roles for people with lived experience. And I know multiple people have brought this up in various meetings. Of course, it is crucial to the success of this plan to make sure that we are including people with lived experience, because nobody knows better what their needs are than they do, than the people who've lived through this. And they're going to know if we're meeting all of their needs, or if there's any gaps in the services, they're going to be able to tell us what those issues are and what we're missing. And so this includes having short-term roles for people with lived experience this year, making sure that we have a compensation plan to pay people for their work and for their expertise. And then by 2024, having a more long-term lived experience advisory board that would be made up entirely of folks with lived experience so that they can remain involved with this as we continue to implement planned strategies for years to come. And then by 2025, our goal is to make sure that we're really using our data to track success and sustainability, making sure that we're monitoring the trends that we see, the different disparities that we see by race and by other target populations, and making sure that we're seeing whether our strategies are successfully reducing some of those racial disparities and other disparities, or whether we see any worsening trends, and then being able to respond to that with an action plan so that we can start addressing that and be very proactive in reducing disparities and making sure that we have equitable outcomes. And then by 2026, we want to make sure that there's a focus on equity in all policy and budget decisions. And so as we have new housing development projects and other programs that we undertake, we want to make sure that equity is prioritized and that there is a plan for producing those equity outcomes and having those target goals. And so when we decide to fund a project, we want to make sure early on in the process that we're thinking about how equity is going to work into this. And then also by 2026, we want to target systemic inequities to increase diverse homeownership. And so this is, again, looking at that policy end, making sure that we have, for example, the non-discrimination policies for source of income, for immigration status, having policies for folks with criminal background, looking at these populations that are most impacted and have higher needs, and having a plan to make sure that we're removing barriers to housing for people, and also producing additional pathways to homeownership for diverse populations. And then the last objective here is that by 2027, we are promoting best practices that improve diversity and equity for all service providers. So this is something where we're going to be certainly communicating throughout as we continue to collaborate, but by 2027, really having that shared methodology, having shared training and resources, and again, having better consistency and communication towards all service providers that are involved in this process. The second page of this document and the link that I shared has the specific strategies and action steps. So definitely do check that out. I kind of gave the summary overview of as much as I could just now, but let me know if you have any questions relating to the equity section, and I think I'll wrap it up there.
Okay. Our next one is affordable housing.
This is Leah Rosen, Affordable Housing Administrator, to present the affordable housing section. But before I move forward, were there any comments or discussion that folks wanted to have about Lacey's presentation, the equity and inclusion section?
And just a reminder, use the raise your hand function, and we're happy to have questions now, or we have time later in the agenda.
Okay, well, I will go ahead and get started on this one. Just give me just a moment to share my screen. So up at the top, as presented, are the affordable housing objectives. The objectives are essentially what we want to do, what change we want to make. And so I'm not going to spend a lot of time on that since it's been presented. Want to move into the strategies, which is the how of how we will increase the supply of affordable rental and home ownership units, how we will develop a new 10-year housing plan, and how we will establish system changes that realign power imbalances so that we can have more access to housing and the development of affordable housing. So the affordable housing section has quite a lot of strategies. So thank you for bearing with me. We have a lot of work ahead of us. We know that this is a really critical issue. So number one, we want to provide grant subsidies for the development of new units with 2 or 3 bedrooms, and targeting 2 and 3 bedrooms to ensure that we have affordable housing stock that's available for families. We want to, or we will, increase permanently affordable housing stock by identifying and acquiring parcels and units to put into the community land trust, which is a way that we can ensure that whatever community investments we make into affordable housing, that those units stay affordable in perpetuity. And that way we can continue to grow our affordable housing stock, rather than some affordable housing loses its affordability after a period of 15 or 30 years, depending on the funding and the agreements. And we want to make sure that, again, we're able to maintain the stock in perpetuity by putting it in trust. Some of you may be aware that the City of Lawrence is currently looking at updating our land development code, and the land development code it influences the affordability of housing in a number of ways. And there has been feedback and thoughts that our city could do a lot better in terms of how our code allows for the ease of development and the cost of development for affordable housing. And so our group is going to be providing recommendations to the Land Development Code Update Steering Committee so that our code reflects flexible, time efficient, and cost effective affordable housing development. Number 4, we will be establishing tenant legal representation, tenant right to representation, so that folks that are tenants that are currently in affordable housing can stay housed. We will, number 5, establish a source of income discrimination enforcement protection. And so the City of Lawrence did pass source of income protections so that people cannot be discriminated against or denied housing based on where their source of income is coming from, including voucher. And so now we want to do one better and establish some enforcement measures to that newly passed ordinance. Number 6 is looking at establishing a vacant structure ordinance that would allow us to seize or otherwise remediate the issue if a property is left vacant or uninhabited. That every house in our community can be inhabited safely and affordably. That houses aren't just sitting empty for any number of reasons. Number 7, we recommend establishing an incentive program within the City of Lawrence to encourage new affordable housing development, specifically looking at tax incentives that the city can be providing to developers to make developing affordable housing an easy and juicy option. Number 8, create a strategy for researching and acquiring funding sources for affordable housing, both one-time and sustainable funding sources. Number 9, developing a plan for ongoing community engagement to support affordable housing efforts. So we know we need to be doing a lot more community engagement and getting our community excited about affordable housing. And so this strategy is really about developing the ways that we're going to do that. Number 10, developing a 10-year community housing plan. We have action steps related to each of these strategies, but I'm not going to go into that level of granularity here. Number 11, create more permanent and sustainable diversified funding sources for the Affordable Housing Trust Fund. Currently, the Affordable Housing Trust Fund has been fed by City of Lawrence general operating in the past, but primarily it's through the sales tax. And so we want to make sure that we are diversifying those revenue funds so that we can be putting more into that trust fund. And then the last few are 12, to develop targeted programs that increase racial equity and affordable housing access and home and land ownership for our BIPOC community members to reduce those disparities currently being experienced. We want to create increased opportunities for community land ownership and property ownership for our low-income community members. We want to develop incentives, prioritize affordable housing as a community benefit for any new annexation approvals. And finally, increase our community capacity for developing permanent affordable housing by identifying and supporting an additional community housing development organization and community land trust. So that's all I have. If there are any questions, we're happy to take them now or at the end.
Leah, there's a few in the Q&A function if you'd like to answer those live or type answers afterwards, up to you, but there are a few there for you.
Thank you, Hannah. I will go ahead and type them in the Q&A if that's okay, and the next presenter can get started.
That's great.
Yeah.
Hello, thank you, Leah, for that presentation. My name is Matthew Falk. I'm the Director of Housing with the Burton Nash Community Mental Health Center. I will be presenting the section on supportive housing. That work group is led by Jill Joliker and Bob Transky underneath the umbrella of the stakeholders group. I'm going to share my screen here. Make sure I'm sharing the right one. All right, is that, I should say, Housing and Homeless Strategic Plan, Community Engagement at the top. All right. So I'm going to quickly go through the goals and then the strategies. I won't say every word here. As you can tell, we've set our main goals to achieve by 2027, and that includes creating housing stock in various different categories. So creating 30 units that are dedicated to folks who are chronically homeless, creating at least 2 units that are dedicated to chronically homeless families, creating 50 units that are dedicated to individual households who are homeless and approaching an elderly stage, so 55 plus, creating 20 units that are dedicated to individuals who are involved with the justice system, creating 15 units for transitional units for individuals who have substance use disorders and mental health or mental health issues, and creating 10 units for homeless families with substance use disorders and mental health issues. And then finally creating 10 units that are dedicated to individuals involved with the child welfare system, so transitioning back into the community. The strategies that we've set for that to achieve those would be: one is to develop a 5-year supportive housing capital improvement plan that it reflects on supportive trauma-informed housing design and community integration, and that really targets designing the different housing types that we want to create, as well as advocating and engaging community regulatory bodies in adjusting or adapting policy, things such as land use codes, to really facilitate for the housing development goals that we've set for ourselves and that we need to create in order to provide housing for households who are experiencing homelessness. We want to establish a community supportive housing case management program that really standardizes the quality of supportive services that are provided across the various different organizations within the community. So currently, there's not a standard way or model for providing supportive services, and that's really about developing some standard practices as we provide services across the system of supports. 3 is to establish sustainable public and private operating and supportive services funding resources. So funding to support staff, funding to support different components of the supportive service system is not universally present. Some sectors are funded and or have legacy funding streams. Some sectors have zero funding at all. So this is really about establishing the financial infrastructure that we need to have a sustainable supportive housing system across all the various sectors that work with all the different stakeholders in housing and family households that might need those services. And 4 is to design and develop an emergency non-congregate shelter service for women, families, and disabled single adults. And that's really about looking at the inventory of existing shelter space, and in the wake of COVID, for example, adapting that system to be non-congregate versus congregate, and then looking at the kind of more specific population needs that need support and need support within a shelter space, and the kind of support that they need within that shelter space. So families, disabled adults, and women, for example. And that is what I have. Let me stop my screen.
Any questions for Matthew, folks? Oh, I see a hand raised and
Yeah.
let's see, hold on, Sherilyn, I'll move you over. A second.
And I will type answers here in the question and answer section so the next presenter can move forward.
Sherilyn, do you have, there you go. Sherilyn, go ahead and unmute and have at it. What's your question? What's your comment?
My comment is, of course, this, what I've seen go on for years, is if somebody relapsed or has a substance abuse problem, I feel like a lot of those people have been denied housing and in fact have been excluded when they relapsed. That my experience was, going back years, that these people should be sort of shunted away. And until they got it together somehow, then you might do something. I mean, I have seen nearly every provider go, you've relapsed and now you've got to go. And I just wonder how you're really going to counter this, because I feel like this has caused death and homelessness in this town, and has also caused people in this town to be very concerned about the kind of people that have severe and persistent mental illness and homelessness to roam around in this very confused state. I feel like it has negatively impacted not only the people that need help, but our community in ways where people don't like the homeless because they're exhibiting this very confused, upset behavior. Thank you.
I can speak to that. So I do think you're right, Sherilyn, that there are times and there have been trends in which people burn bridges for various reasons, and they are left without adequate access to support. So the primary model that we're looking to really fully integrate is Housing First. And the principles of Housing First are really that you provide housing without any prerequisites for the individual household that you're working with. And Housing First allows people to be actively engaged in substance use, for example. I think a large challenge that we have within the local community is that we have to have a variety of housing stock that supports the different types of households that we are attempting to serve with the Housing First model. So for example, if I have a group living space, such as the transitions facility that Bert Nash operates, if someone brings substances within that space and exposes other residents of that building to substance use, those other residents of whom are also in recovery, that challenges their recovery and it challenges their capacity to engage in improving their life. So that, for example, would not be an ideal setting in which we could really employ all the various aspects of a Housing First model. That type of model really needs single occupancy dwelling units that individual households can occupy on their own without necessarily or really limiting the amount of impact they might have on someone else who's trying to recover. So Housing First is not only a supportive service model, it also requires that we have the bricks and mortar facilities to complement the type of service that we're trying to provide. So that we have a long way to go, but we do recognize that those are very specific types of shifts that we have to make within our service system to be successful.
Thanks, Matt. We have another question from Alexis. Alexis, you should be able to unmute and have at it.
Hi, I actually kind of had two questions that also kind of build off of what you were just saying. So my first question is, how are the different types of supportive housing that you're talking about not only going to be accessible to individuals with physical disabilities and very visible disabilities, but also to individuals who may struggle with more invisible disabilities, such as like mental illness? And then kind of building off of that, how are you going to keep these individuals housed after they've gotten housing?
So supportive housing, and I guess I'll have to speak somewhat broadly, includes, a service model and a housing type that is specifically focused for your target population. So for example, we have supportive housing that is targeted for people with mental health issues and mental health disabilities rather than physical health disabilities. Our goal is to have all of our new housing stock accessible from an ADA standpoint. But the next step then is to create the type of supportive service system or supportive service team that works with the given housing facility that is focused on the individual population that you're trying to serve. So for example, there are individuals who are within the aging and elderly population who need assisted living, right? That's a different type of supportive service than someone who is within the mental health population who may be struggling with schizophrenia or bipolar disorder. And the type of training that those staff have will be very different. So, it's really about how you design individual programs. Some we already have a good, a good foot in the door with. So for example, the mental health infrastructure, the substance use treatment infrastructure is a little more developed than some of the other target populations we're trying to serve. And we have work to do in that, in those other areas. We have work to do in every area, but we have a little less work to do in some than others.
Yeah, and what I'm hearing here, thank you, Matt, and it sounds like there's a lot of great questions, and this is an area where we need to do a lot of do some education, some sharing, yeah, there's a lot of great questions, so this is helpful just hearing from folks. Go ahead, Lacey, I see your hands raised, and then we probably need to move to the next focus area.
I just wanted to chime in really quick for the piece on physical disabilities. Within our equity work group, we have folks from different populations represented. And so one of the things that we want considered for all new housing projects, housing projects within the strategic plan is the use of universal design principles for construction, which is a set of principles that makes housing accessible to the broadest range of people.
Thank you, Lacey. Okay, so systems is going to be covered by Michael Montgomery.
All right, thanks, Jill, and thanks, Matthew.
And Michael, will you briefly just share what agency you're with and what you do?
Sure. My name is Michael Montgomery. I'm the Director of Operations for Behavioral Health at DECA, and I saw some stuff in the chat about substance use disorder and people with that, and I agree, DECA is looking at some supportive transitional housing for folks that live in that world. Okay. I'm trying to find here we go. All right, so I am talking about systems today. And if you look at the first strategy, we're immediately confronted with an acronym, so I apologize for that. So HMIS, what's that? That's a homeless management information system, which is basically information technology that collects client level data around homelessness and also data on available housing and services for those people. So the first strategy for the systems focus area is by 2025. HMIS will be accessible for all homeless targeted programs and housing services throughout the community to review, input data, and pull reports. And Jill referenced this at the very beginning. HMIS does not capture every single person in the homeless community. So that, again, one of the strategies is to get to the point where that happens. So just the action steps, determine the number of agencies and programs that need to be included in HMIS. So who is and who isn't. And then connect homeless service providers with continuum of care to show the need for HMIS, and basically just making sure everybody understands that the need to have all of that data so we can make decisions and have a better outcome. Increase engagement with continuum of care by participating in committees and subgroups. Those are the 3 action steps for the first strategy. The second strategy is by 2024, develop a community dashboard, which provides real-time homelessness and housing service data. So this would be obviously important to be quicker in helping to place people into available housing stock based on their needs. So determine HMIS capacity and explore what dashboard items can be created and what the cost would be for that. And really, this should have probably gone before that. Hire a homeless systems data specialist to form and maintain the data so that we can make sure that it's accurate and true. Dedicated staff to prepare key performance indicators, KPIs, to assess progress. And then follow up on coordinated entry systems, special notices of funding opportunities, and finalize details for completion without SNOFO funding. The third strategy for systems is in partnership with the other 4 focus groups, develop a community engagement and education plan with a focus on the importance for good quality data outcomes and the systems used to collect and organize this data. I mean, we need obviously accurate, good, complete data in order to facilitate what we want to do in the other focus areas. So coordinate with homeless service providers and community members to determine educational needs for the public. And then the last focus area for systems is develop key performance indicators based on the goals established within the strategic plan that align with Built for Zero and other targeted outcomes to monitor and report on progress and success. And Built for Zero, just to make sure everybody understands that, is just breaking down silos and barriers and sharing data, so we can have collective action, make sure everybody has access to resources, and it's a state and local cooperation for that. So just utilizing available data resources to gauge a baseline and see where we're at, and then establish oversight groups to assess data and develop the performance improvement strategies and identify gaps. And that's systems.
Any questions for Michael? I know there's a question in the Q&A, and I'll get that answered, but any questions before we move on? Reminder to use the raise your hand function. Thanks, Michael. If you
All right, thank you.
All right, I'm going to transition it to Melanie. And Melanie, just introduce yourself before you get going. Thanks.
Sure. I'm Melanie Valdez. I am currently the interim executive director at Lawrence Community Shelter. And I will share my screen really quickly. Okay. Okay, can everyone see that? Okay. So what I did for the emergency shelter focus area is highlight some of the goals. These were determined using the needs assessment, best practices, and looking at successful programs across the country. And some of the first goals that we have are to identify 3 agencies to act as the coordinated entry access points to provide triage, diversion, and care coordination to those at risk of homelessness, because homeless prevention is a very large part of addressing homelessness as part of the plan. We also want to establish a community severe weather disaster and recovery emergency shelter plan for those experiencing homelessness in our community. And those are the 2024 goals. And then for 2026, we want to establish a 5-member multidisciplinary street outreach team serving unsheltered homeless individuals, including the encampments. And the goal of this would be, this isn't everything, this is just a piece of it, is to connect people to services, to connect them to resources, to offer a wraparound approach so that they can not only have their basic needs met, but also needs that involve like medical and behavioral health needs. And also to respond as a crisis intervention as needed to help those people if they're experiencing a crisis. And then the final goals that we have so far is to address specific demographics and their needs that currently we do not have enough services for. The first one is to increase facilities that provide access to basic hygiene needs to promote dignity and public health by 3, so add 3 more facilities. To increase low barrier, non-congregate emergency shelter beds for single adult males. And I think that we're still trying to get a number on exactly what that need is. So we don't currently have a need or a number in the plan. We want to increase low barrier non-congregate emergency shelter beds for families with children under the age of 18 by 20 beds. And then we also want to increase the low barrier non-congregate emergency shelter beds for acute medical respite care, which has been identified as a high need. And I didn't put a number on that one, so I'm not sure if the plan had that on there. But that is something that we're looking at and want to meet that need as well. We also want to increase those beds for people that are fleeing domestic violence, human trafficking, or stalking by 15. And also increase shelter beds for youth under the age of 18 by at least 15 beds. And then also we need to increase low barrier non-congregate emergency shelter beds for single adult females by 30. Lawrence or Douglas County is a little bit unique in the fact that we do have a higher rate of females in our county experiencing homelessness that is above the national average. So that is something that we are also looking at, trying to meet that need so that there is enough space designated to single adult females. And that is all I have.
Thanks, Melanie. Any questions from folks specific to this focus area? Okay. Oh, all right, Kim, hold on just 1 second. Let me move you into the panel. Give me just a second. Kim, you can go ahead and unmute and offer your question or your comment. Kim, are you able to unmute?
Okay, so what I was going to ask, I guess, Melanie, maybe this is for you. What was the total number of additional emergency beds that you just mentioned? It sounded like maybe greater than 50 all total. And it's not, I mean, that's not a specific number isn't necessarily important. It sounded like a lot of additional beds. Is that an accurate?
Sorry. Yes, I would say that I don't know the exact number we've come to for additional beds. I know the number has probably is over 100, honestly. And I think specifically for these beds, they are non-congregate beds, which we don't have enough of right now. That is the best practice right now. So these are specific and specialized to these groups as low barrier non-congregate beds.
Okay, and so this is a broader question, and I want to say I appreciate everything you all are doing. I know this is a very, very difficult, maybe even intractable issue, but if the goal is, and in reading all of the various reports and surveys over the past week or so, it seems like the goal is zero homelessness in Lawrence by 2027, let's say. And so I guess my question is, how do we sort of reconcile an increase, for instance, of 100, give or take, emergency beds with the goal of zero homelessness? Those two things seem to be at odds with each other, unless by zero homelessness, we just mean no homeless people on the street.
I can answer that a little bit, but someone else may want to add to it. But the goal is to reach functional zero, which means that we have the housing availability to hopefully get people housed quickly enough to where they are not having to experience unsheltered homelessness. But there will be a need for shelter, but we are hoping that it'll be rare, brief, and non-recurring. But we are hoping that as we get all of these programs implemented and these strategies fall into place and we become more successful, that there will be less and less of a need for shelter in the future.
And does that include a time when folks who are homeless, for whatever reason, sort of graduate, I guess, to a point of self-sufficiency?
That would be the permanent supportive housing piece for a lot of people. So I don't know, they can be housed without necessarily being self-sustaining. So the permanent supportive housing would help people, according to their needs, become more self-sufficient or self-sustaining over time to hopefully get to a point where they no longer need as many supports or maybe no supports at all.
Has there ever been any discussion to attempt to quantify that sort of progress?
We haven't had, I don't believe, enough permanent supportive housing experience in our community to be able to quantify it at this point. But it is known to be the best practice and the most successful way to address chronic homelessness.
So this is Matthew with Burt Nash. We do have some quantifiable data in respect to some programs that place people into housing, work with them as a supportive service provider, from placing them from homelessness and level of success. So, for example, the voucher programs, there's a few voucher programs that are operated at the Housing Authority that require supportive service provision in order for the households to receive that housing subsidy. Those have existed for a few decades, and they have about an 80% success rate in respect to the residents who obtain housing through those subsidized voucher systems. So we have about on average, and that goes up and down. Sometimes it's 78%, sometimes it's 85%, depending on the year that you're looking at. It hovers around 80%. So, 20% of households aren't successful, and around 80% are successful. And that's a long time statistic that the Housing Authority has been able to maintain with their partnerships with the other supportive service providers. I think what that highlights, though, is that there remain within the community a population of more acute households whose challenges are more severe, and for whom the traditional access to housing, the traditional models for accessing housing that we've relied upon and had access to, are not sufficient. And so we will have to, within this system, and this is what we're trying to target within the system, is to target those folks as well, and to try to figure out how do we become more successful with more acute populations.
Thank you very much.
Yeah, and thanks for the good questions, Kim, and yeah, thanks for the for answers and trying to help address those, Melanie and Matthew. I want to got a couple more questions. Rick, I'm going to move you into the panel, and then after that, we'll get to Paula. Rick, go ahead and unmute and share your question.
I have a question about how many people are on this viewing of what we're talking about right now. Do you guys know that?
I see 37, beyond the folks that are presenters and speakers.
Awesome. And then there's going to be 2 other meetings that are going to be similar to this. Is that correct?
Correct. There'll be 2 in-person sessions, and I'll share that at the end of the presentation in terms of next steps, but they'll all be next month, and they're listed on the county and the city's websites.
Awesome. Thank you very much. And I really appreciate the conversation. I don't have any specific questions right now. Thank you.
Paula, I'm moving you over to the panel. There we go.
Okay. Okay, there we go. All right, I'm just curious. I helped at the emergency shelter for one thing this winter. And it was, a great way to get to see this, meet some of the people. Got a couple questions. One is, I've wondered, in all of this people getting together, all these professional folks, are we including 2 or 3 homeless people at least in some of these talk times, giving their own suggestions, what they've been through, what they recommend in providing this? And secondly, I do like the fact that I think it's good to simplify. I like what Valerie said, to get it like to 3 different people, 3 different programs, keeping it coordinated instead of about 17, and all the language it takes. Talking, and then plans, but yet get some little things done. Does that make sense? Definitely Park and Recreation did not really, they did the best they could, but they should not have been the ones handling the emergency shelter. Thank you.
Thank you. Well, I will say that we have 2 sessions that, in addition to the community general public sessions that are planned for next month. We have 2 sessions that are planned just for folks that are currently experiencing homelessness. So that is our intent, to have sessions similar to this just for that community, those community members. And then, the equity and inclusion section of our plan calls for some really distinct strategies and action steps related to integrating folks into the decision-making framework of this work.
Good.
Okay. Okay, are there any other folks that have questions about emergency sheltering or general questions before we get to some targeted questions? We're not going to be able to get to all the we had some targeted questions that we wanted to share with folks, and I don't think we're not going to have time for all of those, but I do think that we may have time for a couple of them. So even if so, I'm going to share my screen and just show you all the questions that we'd set up. And we've asked for general feedback from folks. If anybody would be willing to come up to raise their hand and share what they think the most important critical elements of the plan are. And also, what do you think is missing that's important to consider that maybe we haven't thought of? And if you don't feel like you've had time to really think about that today, our hope is that we can be in communication with folks after today's conversation, and that you can outreach with members of the group, and we'll share that in our next steps. But are there other perspectives or contexts that we need to be thinking of? Any thoughts on that before we share some of our next steps in this work? Yeah, I see a couple. All right, let's see. I see hands raised of folks that have spoken before. So before I call on them, are there any folks that haven't spoken yet? Okay. All right, Kim, I'm going to move you back into the panel. And go ahead and unmute Kim and share what you think.
Okay, one other question. I think in terms of buy-in from the community, it would be very important to have projected budget numbers, including revenue sources as well as expenditures. Do you have an idea of when such preliminary data might be available? Thank you.
Actually going to be in my next step slide. So stay tuned, and I'm glad that's where your head's at.
Thank you very much.
Yeah. All right. Rick, I'm going to move you into the panel.
Okay, that was my question also about the funding and how we're going to be sustainable on this. But my main overall feedback is there's been so much work put in on this plan, and everything, every individual leg of it really sounds good and awesome. But there's only 37 people in the community that are on this Zoom call right now. And I know that the public education process of getting anything done, especially something this big, has got to be a huge part of it. So we need to market these plans. And once we get these details figured out, we should even start marketing it now. You guys need, the city, the community needs to figure out how we can sell this whole plan to the public in general. That's my comment. Thank you. Okay.
Thank you, Rick. All right. Oh, all right. Jill Dudley. Hold on just a second, Jill. All right, go ahead and unmute and share your thoughts.
Thank you for admitting me. I appreciate all the work that everybody is doing on this. And I just had a quick question, which falls into some of what you're going to talk about next with the funding, is what work you're doing with community partners to weave some of the funding you're looking at with funding they may have to provide services. And the only reason I ask that is many of us have very specific guidelines around our funding sources. So an example with Independence Inc. Is we provide services to people with disabilities. I have staff that assist people with housing applications, but we don't have any funding for deposits for rent or utilities. So that's a drawback. We can definitely help people through the application process. But another thing that we often, just as an FYI, that we run into when we work with individuals is part of the philosophy around what makes us a center for independent living. And what is also written into funding guidelines is that a person receiving services has to be a person who identifies as a person with a disability. So sometimes what we have happen is we work with individuals that may be out at the encampment or at the community shelter, but they don't see themselves as a person with a disability. So then that makes it so we are no longer able to work with them. So I just wanted to address that a little bit and put that thought process out there when you're working with community partners, that they may have their own guidelines that they have to follow, that it seems like they might be an intuitive fit, but depending on how questions are answered or the person's engagement in their own recovery and whatever process they may be experiencing, they may not see themselves as a person with a disability in my case, which then means I wouldn't be able to serve them.
That's a great point, Jill. And it's making me think, that your perspective, or perhaps a perspective of a member of your team, would be a great addition to our support. I'm immediately thinking of our supportive housing work group, but if there's, we need more folks involved in this work. So I would love to have you or a member of your team join any of our teams, but very good point. Thank you.
Thank you.
Okay. All right. We're going to do questions up until 1:20. So let's see, Paula, I see that you have a question. Paula, go ahead and unmute and offer your question or your comment.
Okay, yes, I'm looking at what, if anything, is missing. I did have to leave the room for a minute. Maybe you mentioned it, but I'm curious about the temporary, like the pallet housing that's going to be up. How fast can that, to me, that's at least a quick way to get people if they'll, a temporary for some time. Did you guys bring that up, or where is that? To me, that's a pretty darn good in between, then being able to find, how do we get the deposit? How do we, where are these places that they can move to?
So I
I
would,
didn't hear that come up.
the pallet shelter will be fleshed out in terms of what strategies and action steps in the emergency sheltering section of the plan. It is a part of that plan.
Okay, it just wasn't stated that I noticed. Okay.
Right. Well, and what I would say with that section of the plan, and I would defer to my friends at the City of Lawrence, but it's a project that's actively under conversation and development. And so it's difficult to put anything firm around it right now, but we know that the city is working towards that, but we hope to have more concrete action steps in the future.
Thank you.
Okay. Let's see. All right. Let me see it. Yeah. Okay. Look at the attendees. Oh, okay. So at this point, I'm going to stop my share screen. Let's see, I know I want to make sure I'm checking the questions. What is the reevaluation process of aspects of the plan that are not going well in practice going to look like? Great question. That's one of the things that when we, oh, go ahead.
I'm typing an answer to that. So,
oh, great. Okay.
But I can kind of summarize here. So the quality improve, that's basically about quality improvement, right? And so a significant component of that process will depend upon the work that we've set for ourselves within the systems component of this plan. How we collect data and how we implement accountability in respect to what the data shows. That's quality improvement, right? So typically quality improvement processes involve assessing data, assessing programs, assessing performance, providing those programs an opportunity to create a quality improvement plan, implement their quality improvement plan, but those plans must have levels of accountability within the system. So that's something that we will have to think about and address is, what are the levels of accountability that exist or that we can implement to ensure that improvement gets made when things aren't going the way that we need them to go. Those processes exist in many different levels for different organizations already, depending on what they're doing, but they don't necessarily exist for this specific plan in a way that is spread across the entire system of services. Typically, for example, with my organization, there are fidelity review processes that we have to go through. People come and do site visits, people look at what we're doing, but it's all about mental health provision. This plan spans a number of organizations and a number of different sectors. So there will be a challenge about how do we implement a quality improvement process that spans such a wide area within the system. But the model already exists within many different sectors. It's a matter of adapting it in this specific capacity.
I also like to say it's a living document. The plan's a living document. It's not realistic to, well, it's realistic and important to commit to the overall objectives and the goals and the strategies and action steps up front. Any changes that we think need to be made in real time to be reflective of what's happening in the community and what's working and not working will be reflected in updates to the plan. And I think because this is a 5-year plan, we're committed to communicating any changes that we make with our stakeholders and also with the community as we move through this. So whether that's quarterly updates, annual updates, you know, that remains to be seen how often we can do that. Sherilyn, I see your question in the chat too, and then I'll move on to next steps. Sherilyn's asking why there are disparities in the Black and Native homeless population. Short answer is, I don't think we have that information just yet, but the work that we've outlined in this plan, specifically the equity and inclusion aspects of the plan, we hope to learn more and better understand and share that out as we move through this plan. But we welcome feedback from our community.
Jill, I can speak a little bit to that. Just to kind of say it in short, the reason for these disparities by race tie back into the context of US history and systemic racism, ongoing disparities that we see in terms of biases and how certain barriers, barriers to getting resources, barriers to getting help, how that affects specific populations. And then again, with our history, the way that generational trauma impacts people that we see affected by poverty and homelessness. So that's the short answer. There's also a long answer, but I'll just leave it at that.
This is Leah Rosen. I'm sorry, just wanted to state, Kim, I saw your question in the Q&A, and I believe that all the questions have been answered, but you may need to go over to the answer tab to view it.
So I launched a poll, and if you look at the bottom of your screen, if you didn't pop up on your screen, one of us can help, but I want to invite folks to respond to the poll. And then I'm going to jump into next steps in our timeline. Give me just a second. And thanks for folks for responding to the poll. Appreciate that. Okay, next steps, timeline. So right now we're getting to the end of April, going into May, we have community engagement and listening sessions with various stakeholder groups planned. So our in-person community sessions are planned for Friday, May 5th, from 9 o'clock to 10:30 at the Union Rail Depot, and Thursday, May 18th from 5:30 to 7:30 at the Lawrence Public Library. That's open to all community members. And we would encourage folks that are in your personal and professional networks, please encourage them to attend so we can continue to have these conversations. Then we're going to have another virtual session at some point, and probably next month at this point, with the Lawrence Association of Neighborhoods. And then, as mentioned earlier, we're going to have 2 focus group sessions with individuals that are currently experiencing homelessness. One of those sessions will be hosted by our friends at the Lawrence Community Shelter, and a lot of gratitude to the LCS team for working with us on that. And then our work groups are going to continue to do what they've been doing, and that's meet monthly at a minimum to refine and align. And when we say refine, we keep looking at your plan, making sure that it's reflective of these conversations, it's reflective of the conversations within the work group, and any best practices that members of our group are paying attention to and listening to, and utilizing their subject matter expertise on. But again, we need more folks that are in those work groups. So if you know folks that would be good to participate, please let either myself or Leah know as a follow-up to this, and we can drop our emails in the chat. And our hopes is that we will have ways to follow up with all the work groups in the future on our county and city websites. And when we say align, we want to make sure that we're not duplicating any efforts and we're not reinventing the wheel. So how can we align the work of this strategic plan with existing strategic plans or existing work or existing bodies that are doing this kind of work? So that's the community health plan, the City of Lawrence's strategic plan, the work that the City of Lawrence Affordable Housing Advisory Board, and there's probably more, but we want to make sure that we're leveraging that work as well, and it's consistent. In June, we will make sure that our work groups and our steering committee are making any changes to the plan that are reflective of the community feedback, like this session today, and move towards finalizing the plan. And then we will represent this plan, a final version of this plan, to the city and the county commission for their approval at the end of June. And then in July, we commit to operationalizing the plan. And then I know this question came up. What we know that we're going to push all the work groups to do the first 6 months of the plan are to develop budget estimates for each of the sections of the plan. If you look at the full version of the plan, the Smart Plus C template, specific, measurable, achievable, timely, the specific, measurable, those elements of this plan compel us to do just that. And there'll be estimates, but there will be budget implications to all this. But a lot of work remains to be done for who's responsible for that and how we can be creative in braiding funding sources together. And thinking about what things can be done in the community that don't require additional funding. And then one other thing that I'll share is that our hope is to have a county and city community volunteer compensation policy that's drafted and adopted so that we can have a mechanism to compensate our community members that are actively experiencing homelessness or have a history of it, to serve in those advisory roles in the work of this group, and have that permanent infrastructure of their support and their advice throughout the next 5 years of this work. And again, that we're compensating them and recognizing their talents and their time for their participation. Okay. That is the last. It's 1:30 right now. I think we did decent on our time. I feel like I want to just check, I'm gonna save our chat. And what we will do after today's session is we're gonna take, obviously, the results of this poll. Thank you for all the folks that have answered. We're gonna take the conversation that have been in the Q&A, and we're gonna make sure that we're documenting questions that have come up in an ongoing FAQ section, or FAQ listing that is going to be listed on the county and the city websites. We're still working out the mechanics of where that's going to live and what it's going to look like, so be patient with us. But I'm going to do what I said I'd do a minute ago, and I'm going to drop my email in the chat. Okay. And feedback that folks have, please reach out to myself. Thank you, Leah, for dropping yours. And I hope you walk away with understanding that this is a team approach. I want to thank all the folks who have their video on right now for being prepared to facilitate and scribe a breakout group, but it didn't happen. But the faces that you do see on the screen, I've been actively involved in the work of this plan, along with a whole lot of other folks, and grateful for you all and grateful for everybody else that joined today. And with that, we will end this webinar, and I thank everybody.